level of care. Last year in our district, we doubled our taxes to support Coastal Life Support District. The average patient load in a metropolitan area in the United States to take care of somebody from out of your district is about 5%. About 1 in 20 patients you take care of from out of your area. In our area, it's 45% of our people are not taxpayers. That's 9 times the national average. It was an uphill fight to get the tax doubling to support that, but our people know that it's worth it. Even though last year we had to write off over $650,000 in uncollected debt. We encourage you, because of this, to continue to please consider funding the support for essential emergency care for our citizens, and more importantly, for the peace of mind of the visitors to our beautiful and remote coast. I thank you for your support, and with your indulgence, I'd like to excuse myself. I have a 4-hour drive home tonight, so thank you for helping out.
Thank you for your patience, Scott. Next speaker is Bruce Longstreet, please, followed by Rose Albano.
Hi, I'm Bruce Longstreet with Anderson Valley Ambulance, and we too are very grateful for the board's support. We're a BLS service, which is a basic life support service, and we're staffed by about 30 volunteers. As you can imagine, in Anderson Valley, we're a bit off in the hinterlands, small population and a big territory to cover. And of course, we have the same budgetary problems that most of the other small services have. We have a great crew, but we have a big area to cover, from Paul Dimmock Park all the way to the county line going east and west, and halfway to Ukiah and halfway to Point Arena and Elk going east and west. We'll put the money to good use, mostly for training equipment, operational equipment, and also some safety equipment for our crew. But I just wanted to express it's nice to know that not only are our efforts and importance recognized at the county level, but also supported. And we're very grateful, and we hope it'll continue in the future. Thank you.
Thank you. Rose, followed by Bob McAdoo.
Hi, I'm Rose Bono. Like everybody else here, we have large transport times, and we are a volunteer BLS crew. The money that we've gotten, we're going to use for training, hopefully to train some more EMTs, because we don't have very many, and probably update a lot of our equipment. We really appreciate all the funding and everything and all the help that you've given us. Thanks.
Thank you. Mr. McAdoo, followed by Tom Henrik.
The board members, I sincerely appreciate it. Excuse me, the amount of money you gave us. It's allowed me to retain staff, and I even have a waiting list of employees now wanting to work in Willits. So thank you very much.
Thank you, Bob. Mr. Henrik, followed by Jim Little.
Thank you. My name is Tom Henricks, the CEO of Cloverdale Ambulance. As you might not know, we are based out of Mendocino County in the northern part of Sonoma County. We are a public entity. We are a healthcare district. We also operate with full-time and part-time people. I've been there 20 years, and we've been serving this rather large, unpopulated area of southern Mendocino County for all those times on a mutual aid basis. And I would just want to say thank you for allowing us to cover that sparsely populated area, and for these funds to continue to happily serve that southern part of your county, and these funds will help us backfill our area in our rather large, also sparsely populated northern Sonoma County area. So thank you very much.
Thank you.
Jim Little from Laytonville. I sprayed gorse with 2,4-D-245-T in 1972, but that's you probably don't want to go there.
Mr. Little, stick to the issue, please.
Like the others, yes, it did.
Yeah. I rest my case.
I think they called that Agent Orange. But anyway, like the others, I'd certainly like to thank you for the monies that you've contributed towards EMS. Certainly, this situation we face is not entirely of our own making. Our collections are down to around the 25% level. and largely due to Medi-Cal and Medicare reimbursements. And without some solution at the state and federal level, this problem certainly isn't going to go away. But your contributions have certainly helped us weather through this. We are going to have to look outside the box, I think, in the future at really resolving this issue to be able to provide the highest level of service to our citizens under the constraints that we operate in as largely volunteer. With the money that we've received, we'll continue to have our two paid paramedics 24/7 ALS service, and we're also going to be upgrading some of our older equipment. So thank you very much. We really appreciate what you've done for us. Thank you.
Thank you, Chief. Carmel.
Okay, well, it was very nice to hear from our first responder agencies. Six of the 9 agencies were here to speak today. You know, we have a shared vision for sustainable quality EMS services. Very difficult to do in a time of shrinking resources. Probably over the next few years, this won't turn around quickly. So as Mr. Mitchell had discussed, we are planning a committee to work with our community partners and first responders to collaborate to come up with short-term and long-term solutions to this problem in this county. I think that the comment was made about state advocacy, and that's something that we are definitely doing and will continue to do, and will actually beef up. You know, certainly the state's been talking about a statewide trauma system. We haven't even seen the plan yet. So it's something we really need to do as a small rural county, is to really advocate at the state level for this county and all small rural counties. Also, locally here, Coastal Valleys is working with our local providers to develop a handoff policy for interfacility transfers. Essentially what that means is to keep our ambulance providers in county on the ground where they're needed. When they transfer to Santa Rosa, it certainly takes them out of Mendocino County and also takes their time. So Sam Barnett will be working with our local providers on a handoff policy, which means that we drop the patients off in Santa Rosa and the ambulance transport comes back as soon as possible. We are researching and will continue to research best business practices for EMS billing. You've heard today about write-offs, you've heard about collections down. We plan on working with the agencies to research where are the billing agencies, what are our existing first responder agencies doing, how can we help them recoup more of their dollars. We also plan on sponsoring an information session with the local providers on not only awareness information, also on education around billing practices and available resources. We are considering looking at other government funding to subsidize the ambulance services. Essentially, what do we have in public health that's discretionary that we could use? And I think it's something that this board could look at as far as our tobacco funds. Also, we're looking at a single point of purchase for equipment here for Mendocino County that we would do. The county would look at a single point of purchase for the ambulance agencies, and if we had some economies of scale, could we get a better price or reduced rate for some of the equipment that the ambulance agencies need. Coastal Valleys, again, is providing additional training and technical assistance. That will be ongoing. And Coastal Valleys, Sam Barnett is also forming a quality assurance committee that they will staff and we will staff to look at issues and deal with solutions. I mentioned advocating at a state level. I can't stress that enough. Certainly, we're a small rural county with multiple needs, and we need to have our voices heard. Lastly, as a long-term option, I believe that we really need to look at the possibility of an exclusive operating area in this county. What would that mean for Mendocino County? Is it something that we can do more on a regional level? We're in a Coastal Valleys region. We're talking Napa, Sonoma, Mendocino. Is there something we could look at for Mendocino County, some of our outlying areas that don't have a lot of business, but they still have 911 calls, and the people that live in those outlying areas need the services, and if we're traveling in those areas, or tourists are, we all need the 911 service, and can we build upon what's happening in Sonoma and Napa? So those are some of our strategies and our activities